Hey folks, welcome back. One more segment here at Baptist Health College as we continue our Kickoff to College and Career Weeks. Got a couple of current students here at Baptist Health, welcoming Micah Elpers and Sharon Ruiz. Both, thank you both for being with us. We appreciate it. So Micah, you're a radiology student here, right?
Radiography.
Radiography, okay.
Yes.
I'm glad I got that right. So tell me what you do as a radiography student.
Yes, radiography is in the medical imaging world. We help with like x-rays and MRIs and CTs. Here at Baptist, we learn mostly diagnostic, which is your typical x-ray, but we get introduced to the CTs and MRIs, and we will do rotations through ultrasound and nuclear medicine and all the other imaging modalities.
Okay, I got a lot of questions for you. I want to come back to you, but I don't want to leave you hanging here. You're a practical nursing student.
Correct.
Here. Yeah,
yes.
So you're getting close to graduating too, aren't you?
I am.
Yeah.
Yes.
Well, questions for you too. But Micah, I wanted to ask you a little bit about the allied health program here, because there's a lot of disciplines that you can study here through that, right?
Yes. Baptist offers many other options for allied health. Allied health really encompasses a lot of healthcare. When you think of healthcare, most people think of like nurses and doctors, right, but there's a lot more that goes into it. Obviously, we need nurses and doctors, but us allied health people, we help with the medical imaging, the therapies, so occupational therapy, physical therapy, and respiratory therapy, that's a big one, but we help with the other side of healthcare.
So Micah, elaborate a little bit more on what they offer here with the allied health.
Yes, here at Baptist they offer a multitude of allied health programs. Some of the biggest are radiography, which I'm a part of. They also offer a occupational therapy assistance. They offer surgical technology, which is a big program. We recently went through our sterile technique, learning about that, which was taught by those instructors, which was really good. And also we have like sleep technology, which was a whole world I didn't know existed until I got here.
When did you know you wanted to study radiography? Before you got here, or was it something that you decided to do when you were here?
A little bit of both. Really? I grew up in a medical family, and I knew I didn't want to be a nurse because I didn't want to be that hands-on, but I wanted to help. And so exploring the allied health world, I found radiography and knew that was for me.
Sharon, when did you decide you wanted to be a nurse?
So I actually, right out of high school, I knew I wanted to be in the medical field in some way. I've always been very passionate about caring for others. So at first I really wanted to go towards med school, but throughout college at UALR, I looked into a few nursing programs, and then I decided that I would benefit more hands-on as well, becoming a nurse, so I chose nursing as a career.
So you did look at other programs, because you really, when you go into this, you know, you kind of go into it cold, but what was it about this place and what that's for me?
So actually, I did a lot of research. I had been in a previous program before, but I found that Baptist really has, it's more of a non-traditional. It's a 12-month program versus your traditional 18-month LPN program. And with me already having 2 kids of my own, I really wanted to pursue my career a little faster
and get to work sooner.
Yes. So I'll be graduating in June, actually. So I'm really excited about applying everything that I've learned here and pursuing my career as a nurse.
So many wonderful things about nursing, because you really do get to positively affect people's lives sometimes in situations that aren't great for them. But you had this ability, this compassion, I guess is the right word, and you know that that's something you want to get out and get in the real world as quickly as possible, right?
That is correct.
And I was noticing when I was talking to you, I see the sign behind me that says think like a nurse.
Yes.
And I suspect you're already thinking like a nurse.
Correct, right? Yes. And with all the experience and all the knowledge that I've gotten from BHCLR, I feel like I'm ready, especially with our clinical settings. You know, they're very hands-on. We get to really practice and provide hands-on care to our patients, and I feel very prepared thanks to our faculty at BHCLR.
Yeah. Do you know the next step?
For
in
what?
terms
I'm
of where
sorry.
you're going to work. Do you know yet?
Not yet.
Not yet?
I'm looking. I'm doing my research.
Yeah, they're going to be bidding for Sharon for sure, and maybe it'll be right here at Baptist Health. How about you, Micah? Do you know where you're going next? When I know you've got a little bit more in school to go.
I do. I am also not from Arkansas, so
Okay.
my spectrum was really big. I don't know if I'm going to go back home.
Where are you
or if
from?
I'm from Colorado.
Okay, well, welcome, yeah.
Thank you. And so I have no clue where I'm going to go, but I'm keeping my horizons open because I'm willing to be wherever I need to be.
Well, you're going to be well trained for sure here at Baptist Health. Thank you to the both of you. I wish you the best of luck. We've really enjoyed our time here at Baptist Health College. Encourage you, if you're thinking about any of the fields that we talked about with allied health, or you want to study nursing, please check out that information on your screen. Don't be afraid to come ask for a tour. Don't be afraid to ask questions. They are such great folks out here at Baptist Health College, and I hope you'll consider them if nursing or any of those other fields are for you. Back on Good Morning Arkansas in just a couple minutes. Stay with us.